In today's video, we will be talking about the EMREE examination. One of the most important questions that people ask was how long does it take to prepare for this exam? This exam can take you anywhere between 1 week or 3 months. 3 months is a very good time to prepare for this exam, but candidates have also prepared in around a week's time. I was an intern, I was working, I did not take any study leaves. That's why I took around 3 months to prepare. One other question that most people ask me is, what resources do you use for the preparation for this exam? Now, if you refer to the website, there is no specific resource for you to study from, and learning resources or the learning materials that they have mentioned on their website is just a study aid, which will help you to study for this exam. Now, I'm sure most of you wouldn't even finish reading the names of the textbooks mentioned over there because it's a very huge list. So my advice was to pair up my studies with an international exam. Always make sure that you have a backup plan. If you have multiple options lined up, it will be easy for you to choose later on. You want to go to US or UK, or you could either be preparing for USMLE or you could be preparing for the PLAB exam. The advantage you have over this is you have a material that you need to prepare from, and you go through that material in an in-depth format. The level of questions that are assessed in the EMREE is similar to any international exam. So if you feel you're confident enough to give an international exam, you would be confident in giving EMREE as well. I also had someone that asked me, how difficult is this exam? Is it easier for the graduates from UAE, or foreign medical graduates find it difficult? Well, the teaching pattern for any medical school is different all over the globe. People who graduated from India would have a different understanding on the topics. People who graduated from UAE would have a different understanding on topics. Even within different medical schools in the same country, you would have a different depth of understanding various concepts. One good advice on this would be, try to focus on reading all the topics into 4 different categories. First, analyze what the diagnosis is, what investigations you would use, what are the treatment options, and what are the side effects of the medications. If you try to analyze this for each and every topic you go through, I think you would cover a vast majority, which will make you ready for the exam. Some tips or tricks that can be useful for you all when you're preparing for this exam. First, it doesn't take much of your time to prepare for this exam if you plan ahead. I spend around 2 hours daily for a period of 3 months to prepare for this exam. Some may require even less, some may require even more, but once you understand what you are preparing for, what's your materials you're going to use, you will eventually figure that out. Second, try to form a study group when you're studying. And also remember that 2 minds on one topic is much better than one person struggling to get that topic into his head. Try to grab your friends around or join online groups and discuss materials with each other. Don't forget to review the past papers. You will find abundant material on many WhatsApp or Telegram groups. There could be many controversial questions for which you will not be able to know what the correct answer is. So the best option is always study with the questions in hand. So you know at the end of the time that why you are going to choose that option and why you feel that answer is correct. Always trust your gut, trust your feelings, and focus on preparing it yourself. Or one other useful tip that I could give is always use your medical school textbooks. What you have used for the past 5 years, that could be your best guide into understanding topics into depth, because the knowledge remains the same. So use them as your guides whenever you're studying. If you get stuck at a question, be it surgery or medicine, or go back to the medical school textbooks, try to review the topic once again and you will get through it. Now, for those of you who haven't followed my Instagram yet, join them. It would be somewhere here. I post frequent case scenarios I see in the hospitals on a daily basis, and I also post medical information that is with the recent updates, be it from journals, be it from articles, so that we can understand the latest research and trends that's happening and be updated at all times. Hope this video was informative, and see you in the next one.